The US, we got a late start. In Taiwan, they got a head start. Before people say ready, set, go, they were already preparing for it. So when people say go, they were running. They quickly went on the airplanes of people who were coming from Wuhan. Before they deplane, they checked their symptoms. So they were very vigilant in detecting possible infections coming in. They activated the National Health Command Center that they had set up after SARS in 2004. That allows the government basically to have interagency coordination. And then they use big data, and they integrated the data set from the National Health Insurance Program with the data set from the Immigration and Customs database. So when a doctor sees a patient, it was said that this patient has been traveling to different countries because they got the immigration data. For example, if you have people coming from Wuhan, where the epicenter, they will ask more questions about if they had fever or cough, and they may order a COVID-19 test. So they integrated the data, they used it for disease detection. Health officials will call these travelers under quarantine 2 or 3 times a day to make sure their symptoms didn't get worse. And if they get worse, they will help them to get to the doctors. If they didn't, they continue to stay home and they will bring them food. If they break quarantine, let's say they decided to go out, the government will go after them and they will give them a big fine. So more recently, they started to pay people during quarantine. So you're getting paid to stay home, basically, if you're under quarantine. So that, then people wouldn't worry about food or housing. Government took control of making masks and distribute them because they realized that this is a critical materials for fighting this epidemic. So really, that they block a lot of people from coming to the hospitals if they have symptoms. And then if they have fever, they are triaged to another place, right, to be taken care of in another place. And so these kind of policies and procedures are ongoing in every single institution. And certainly in public buildings, when you walk in, there's a scanner, and it could tell if you have fever on the computer. Okay, this person has fever, you gotta take a temperature, you can't go into the building. And so those are the things that they're automating. I mean, their schools are open, kids go to school, and they have their temperature taken, but they go to school. I think a lot of the public health preparedness is about having the right infrastructure that you could activate during a crisis. And I think we have just been relaxed for the last decade, and certainly in the last few years that there's not been enough attention at both the federal government and some states to really prepare us for this a quick response. The US, we got a late start, so there's a lot of work right now in every single hospital, every single health care institution in the country preparing for this. Right now, we should take this lesson very seriously because it's going to hit us hard, but hopefully if everybody could do their part and stay home, the disease spread will get a lot slower, and then we could handle it. We will have a chance.